you touched on it there. The current state of healthcare in Canada, you guys are both surgeons, you deal with what I would call acute injuries. It seems to me that the people who speak the most positively about healthcare in Canada will say that while it's not perfect, you won't die of an acute injury necessarily, because there's available treatments, and thanks to ER visits, things like this, you can get those treatments fairly quickly. Now, you may not get specialist referrals or things of this nature, but as far as the work you guys do, most proponents would say that this is readily available and the system is working okay.
Well, I think I think that urgent things are not being treated well now. What we're doing is we're delaying access to all kinds of healthcare now, that people are being turned away from emergency departments. Ambulances are, basically lining up to get patients into the emergencies. The emergency departments are closing, and we know that patients die when they go home. Sometimes some of them die, and there are many tragic stories. But overall, I think the big issue is that we have a very dysfunctional organization, or disorganization would be a better word, in this government-run monopoly. I think few Canadians understand that we live in the only country on the planet Earth where it's illegal to, for example, obtain private health insurance. It's illegal. That laws like that don't exist in all of the authoritarian countries, in the communist countries, and yet they occur in Canada. And this is a bizarre situation, and it's all well and good that for the government can promise you health care, and then they fail to deliver it, and then they make it unlawful for you to do anything about that. That just, in a free and democratic society, that's not right.